but between 5 to 10% of the people in the country, they use online telehealth, telemedical services, and up to 50% would be willing to use such services, especially in this context of the pandemic, when the availability of medical care is absolutely essential, but it is not always readily available because a lot of doctors and nurses, a lot of medical staff, they also get infected, they fall ill, and there is a shortage. This is especially relevant for patients in oncology, in cardiology, patients with chronic diseases that require constant monitoring, constant supervision. Based on that, and also based on our research and innovative experience, our university recognizes and appreciates global trends, the current problematic, and the internal trends in the industry, in the telehealth industry. We have been making progress with the goals at hand, and we try to be as proactive as possible. Using telehealth technology in healthcare at our university is a very important topic. We expect increased accessibility of medical care to patients and a launch of a number of breakthrough projects, innovative projects, which have the potential of transforming the industry, of transforming the system. And we hope this will be another driver for the overall digital transformation of our university and a lot of other stakeholders, which will benefit the whole industry, especially with the outpatient services. I would like to remind my colleagues, maybe some of you don't know it, but our university has been a winner of the 2030 program. We won the special part of the grant, and we were ranked in the highest, in the first tier, first category, with the highest amount of financing. So we have our problem of development. By 2030, research, development, innovation, and medicine. The university has affiliation with some of the biggest clinics, a hospital with a very good outpatient capacity, very good outpatient capabilities. And one of the areas of development for our university is also large-scale testing and delivery of digital services in decision-making, robotic automation. This testing, importantly, is led by scientists and researchers with a lot of experience under their belt. So I think it is very important that it's on the platform of our university that we have been developing this serious approach. We already have good groundwork for these efforts, and I'm sure we will hear more from our colleagues, and we will have a chance to discuss this experience, to exchange our views. The relevance of telemedical technology is especially high these days amid the pandemic, and we have to be adapting very quickly to new challenges, to various mutations and changes in the severity of illness. Of course, we have been taking advantage of technology, including telehealth technology. January 17, 2022, at the meeting of the Coordination Board for COVID, the Vice Deputy Prime Minister, Ms. Golikova, mentioned the vital role of telehealth, and given the reduction to 7 days of the Omicron-related quarantine, it was decided to expand the opportunities for telehealth and remote sick leave opening. There has been a recommendation for people with certain cardiology-related medical conditions. Of course, there is a lot to be done, a lot of discussions to be conducted with medical associations and government agencies. We need to aim for optimal solutions, but so far we've had a lot of good, solid discussions and testing. On January 20th, 2022, at the weekly meeting, Mr. Murashko, the Ministry of Health and the Director of the Financial and Economic Department, Ms. Sibirikova, they proposed a draft for coronavirus-related infection telehealth services. This is a good proposition, I think, and I think, colleagues, we are in the middle of a robust process of testing, research and development, and the ultimate goal is, of course, to benefit people, patients, and to increase the quality and accessibility of high-skilled medical care. And a couple of words about our university in 2021, and we will hear more about this from our colleagues from the university clinics and the wider healthcare system in the region. For example, we will hear about remote monitoring of patients with elevated blood pressure. We will hear about the experience of successful testing in clinics of this new case. The test name is the disease box, so to speak, specifically for patients with COVID, with heart diseases. Also, the central municipal hospital in the region will also make a presentation, and our near plans, they include the creation of a remote medical care center. This will be a new format of work. It will concentrate all the telehealth projects in the region. Secondly, the digital hospital with remote digital monitoring, especially before surgery, after surgery, at home. We'll also launch other areas of telehealth for different types of diagnostics, rehabilitation, etc. And also, we have been working actively on creating the system for supporting medical decision-making. Another objective of ours, projects called Priority. So one of the goals there is the reducing shortage of talent in the market. And as a federal university, one of our goals is to transform education programs to create this doctor of the future, quote unquote, who will be able to take advantage of robotic automation, digital technology, etc. So the set of competencies should be at a different level. So one thing is outpatient care, hospital care, and then there is another set of competencies for highly skilled digital high-tech medical care. So we are trying to work out this optimal profile of this doctor, of this medical specialist, and we try to target that in our educational programs. So we have been making progress there, and we will keep you posted on our achievements. All I can say is that the university is ready to be a prominent platform for discussions, a methodology center that can take over some testing, scaling, methodology aspects. And we are looking forward to exchanges with medical associations, with our foreign partners, because without such discussions in our inner circle among specialists, it will be pretty difficult to promote this topic among the wider population. The university, as I said, has very strong clinical capabilities. We have a research and technical park. We have more than 100 programs at the university working specifically on these new solutions for education and for medical applications using VR, AR, neurotechnology, artificial intelligence. We have ideas about registration. A lot of our projects have been registered. We have a simulation center at the federal level. We have recently, by the way, opened this hub for collaboration between businesses, students, faculty, tech entrepreneurs, the government. My point is that the university is this methodology center for independent, for in-house development, testing, project launching, and also a platform for our partners. Partners that include some of the biggest enterprises in the company, IT companies, tech companies. So this link from an idea to a product to scaling a series of products that has already been established, it's up and running. For example, we have this anatomical project with an IT company. We are selling it in 8 countries around the globe, and we are selling some other projects, not just in Russia, but abroad as well. This is good experience, and we're happy to share it. Thank you for taking the time to participate in this round table event. I hope it will be useful and interesting for you. And I'm sure this is not the last of its kind. We will continue with our partners. So thank you for joining us. Happy to see you all here. And maybe with this, I would like to give the floor to Ekaterina, and then we will move along with the agenda. Ekaterina, over to you. I'm sure you will do a great job at moderating this. Yes, thank you, Alexander. Thank you for this for these opening remarks. Good morning, colleagues. Just a couple of minutes of your time for a couple of remarks. First one is that this event is for all of us to encourage you to be active, to put forward your ideas, your suggestions, to ask questions. A lot of interesting presentations in today's program, but I hope we will have more time for discussions rather than just presentations. If you have any questions during the presentations, you can send them in the chat. We will be keeping an eye on the chat. You have 2 opportunities to ask your questions during the presentation in the chat and after the session. we will have some time for a general discussion. Also, please make sure you are on mute if you're not speaking. And if possible, please turn on your video, turn on your camera, especially if you're asking questions. I see this message from my colleagues in the chat that there is this globe icon on the control panel. For Russian speakers, please select the channel in Russian. So you will be hearing simultaneous interpretation into Russian. So we have a pretty packed agenda, so if possible, please be mindful of the time, so we have more time for questions and discussions. Thank you very much once again, and with this, I give the floor to the next speaker, Dmitry, Deputy Minister of Health of the Republic of Bashkortostan. Dinara, over to you. Hello, thank you, Ekaterina. Colleagues, I wanted to talk about the pre-trip medical checkups in Bashkortostan. Quick video.
Сейчас, секунду. Досмотр. Вводим свой кабельный номер. Перед тем, как сесть за руль, все сотрудники автопарка проходят медицинский осмотр.
Before a trip, all employees in the park, they have to undergo a checkup, measuring their blood pressure, pulse, temperature, alcohol test. There's no need for a nurse to be in this medical unit. All the data will be transmitted remotely. This is what is done before every trip. Sometimes we have to set off early when the nurse is not there, for example, at 6 in the morning, and with this, it's much more convenient. Now, the condition of a driver can be assessed remotely and very quickly. Previously, it was not possible, but now what's important is that it might be a challenge, but here everything is completely objective. And also the data is always ready for analysis. Up to 40% of drivers in Ufa, they have a risk of hypertension because their blood pressure is elevated. This is valuable information because the doctors could use this information to reduce the risk of heart diseases. The data on high-risk drivers have been transmitted for further follow-up detailed medical examination. And there is also a possibility to remotely make adjustments to therapy, for example. The work of shift nurses and doctors is supervised at the Republican Cardiology Center. The digital technology helps in decision-making. It streamlines the checkup procedure and it's also helpful in preventing heart diseases. So, regarding this experience of implementing remote checkups, pre-trips, and identifying high-risk drivers with hypertension, during our work with this high-risk population, amid the pandemic and given the fact that we need to repurpose a lot of hospitals and clinics, this special regime for pre-trip medical checkups is particularly relevant. The access to the medical organization was limited, and the only solution was to automate these pre-trip checkups in order to do this remotely.
So we have special hardware which collects and fixes and then transmits the parameters of the medical checkup, such as cellular pressure, pulse, body temperature, alcohol in the blood. And so then the employee assesses this data to decide whether the employee can start working. Now, during the first month of the performance of this work, we showed the opportunity of identifying group of risks with hypertension. So in order to normalize the indicators of blood pressure, there's a number of measures based on this digital technology, and it consists of the following stages. First, the driver undergoes a checkup. Then the digital database allows to form a risk group, and the data on this risk group is sent via protected channels to the Center for Managing Cardiovascular Risks, to the cardiological center headed by the chief non-staff cardiologist. So then this category should be then transmitted to general checkups, regular ones, and they give recommendations on improving the health. The first results show high efficiency of these measures, and they have been highlighted during many conferences. After 6 months, there were 3 companies in Ufa that participated. In 6 months, total number of checkups was almost 15,000. Based on the analysis of blood pressure during automated medical checkups, we formed a risk group for arterial hypertension of 40 people. So this allowed to reach the target numbers of arterial pressure with 32 out of 40, which is 83% of the risk group. One employee can test up to 100 drivers per hour. There's no manual labor and no personal contact. There's no time lost to visit the medical institution. Then the management has data access to this data through a personal profile, and then the various automated reports are formed afterwards to make managerial decisions. This technology that allows to cancel the opportunity for the unhealthy employees to start working, and thus raises the safety. The risk groups also deteriorate the risk of cardiovascular diseases with the people by 80%. Thus, one of the most important indicators of the national project healthcare is performed, increasing life expectancy of the most high-risk group of the labor-capable population. So automating this automation was included into the regional program of fighting cardiovascular diseases, and the results were showed in December in the government of the Russian Federation, and received a very good mark. This dynamics of the number of medical inspections, this shows the need for automation. The number of inspections in a year increased 7-fold. So what I wanted to say is that these technologies are aimed at objectivity and the quality in increasing the good quality of work. Bashneft, Geofysica, Bashkiravtodor are among the companies that use that. Support on state level is done by various institutions. The Ministry of Industry and Innovation is directing the attention of the big companies of the Republic to the opportunity of digitalizing this medical control, considering the introduction of digital certificates for drivers to get to work. This allows a scale out. We started integration the database, the daily database of automated inspections to the information system of the Republic of Bashkortostan. The Ministry of Healthcare of the Republic of Bashkortostan sent the offer to integrate with Rostelecom, to integrate this data with the electronic history of the disease. Right now, it's on the finalizing stage. The model for integration has been developed like this: full automation of the processes of transferring data, measuring blood pressure, and getting that into your medical card, forming a signal information for a regional doctor, And for people having high blood pressure, they get into the risk group. There's opportunity for distance checking by the Republican Center of Managing Cardiovascular Risks. And with this, we ensure the performance of the clinical recommendations of the Russian Federation. And it can be scaled out to 32 regions. The Russian Federation that work on the basis of Artemis. In the Russian Federation daily, the automated medical inspections are done by 30,000 drivers, and their numbers are constantly growing. But 20-30% of the drivers have a trend of higher blood pressure, and so ensuring this automation and integration into medical systems will allow to impact the health and increase life expectancy of about 6 to 9,000 employees. Thank you very much for your attention. Thanks, Dinara. It's a very interesting example of a specific result. Maybe just one quick question here when we're talking about e-health. There's the matter of whether the percent of mistakes is high or wrong outcomes. What was your experience? Whether the system is more precise compared to the personal inspections? What's your experience here? Well, based what we have, 98% precision is the wrong, let's say, inspection. Say he didn't take his blood pressure in the right way. 96% precision, but then the doctor should look at and correct. It's still about the doctor. The machine just helps and pays our attention to something. Thank you, Dinara. I'd like to pass the floor to Rodion Sigalov. Rodion Sigal from the Israeli clinic. Please make your presentation, and it would be very nice if we could review the practical aspects, the advantages that you see, the possible risks, and what your experience is on minimizing these risks when using telemedicine. Thank you. Hello, dear colleagues. Thank you for making it possible for me to speak here. Our colleague and the supervisor of the country of the Adasta Clinic but wasn't able to participate in today's meeting. But with all that, she wishes all the success in working in this session. Just 1 second, I will try to turn on my presentation. First of all, I'd like to tell you in general about the Adasa Medical Moscow in a nutshell. Sorry, to share our experience in working of the International Medical Cluster Skolkovo. So the center is the official branch of Adasa Jerusalem, and it coordinates even horizontally with doctors of Adasa Moscow and Adasa Jerusalem. We are the sole participants of the International Medical Cluster, which allows us to work complying with the Federal Law 160 that allows us to work in Skolkovo, to use medical equipment and some chemicals that are not usually allowed. So the doctors can work only with confirmation and confirmation of their license, medical license on the territory of Russian Federation, which makes it easier for us, allows it to implement in the Russian Federation and Moscow all those technology and the progressive methods that are possible and developed in Israel. In 2018, we opened the Diagnostic Center. It is now working for 3 years. And on this slide, you can see the indicators for the end of 2021. Specialists therapeutic specialists, and the full spectrum of diagnostic research. At the end of 2021, the 18th of October, we opened a hospital, 25,000 square meters, 100 beds, and it's a multi-profile center, mainly related to the oncological health, ray therapy, anti-tumor therapy, and a surgical division. The third stage in 2023 will open the Center for Chronic Diseases. Of course, as we know, COVID made some corrections into the performance of the majority of the clinics in the Russian Federation and foreign clinics as well. For example, the flows were decreased, the flows, I mean, of medical tourism. And on the other hand, it gave a very big jolt to development of medical technologies inside the countries. As many other clinics, I think we are developing online consultations, developing the second opinion, and introducing new technologies and gadgets for telemedicine. Using Hadassah clinic experience, it includes cooperation with Israeli doctors. Considering the closure of borders, this is a statistic here, 1,400 teleconsultations, out of them 102 were made with specialists from Israel. So what we are saying is that the majority are second consultations came to us, which were appointed treatment, and then they needed to correct this treatment in a distance way. So in principle, this was done, and this complies with the legal aspects and the law as well. So here we cannot step away from that. With that, 102 teleconsultations with Israeli specialists are the consultations of patients which on the first stage underwent treatment in the head clinic in Hadassah in Jerusalem, and then after coming back to Russia, not just in Moscow, but in other regions, they need consultation, further follow-up, say, with the diseases, with cancer. And so we made these consultations together with our doctors and the doctors from the head clinic. This was all horizontal, without any difficult bureaucratical procedures. Second opinion is also important. You can get that with the Hadassah Medical Moscow Center, and there's the Hadassah Jerusalem specialist as well. But here we're talking about the coordination of doctor, patient, doctor. Because in any case, we need to estimate the objective status of the patient, because the doctor is the specialist that can see more than the patient can see. And if you take a look at the area we're currently developing, the oncology, radiodiagnostics, CT, and other technologies, allergology, cardiology, and surgery. These are the requests, most often requests for a second opinion. So here, possibly, the specialists working in these areas are lacking in the Russian Federation. Talking about medical technology, this is called expanding the borders of telemed. In accordance to the telemed itself, we're getting description of the disease in coordination with the patient, getting the understanding of their state, or maybe changing the tactics of treatment after 2 or 3 meetings. Here we're also talking about cooperation on the territory of the hospital. So because we are well equipped, very well equipped with the state-of-the-art medical equipment. For example, if we talk about surgery, we're developing cooperation with Israel. The distance participating from Jerusalem, participating right here, happening in Moscow live. This happens through telecommunication and the OR1 operating system. So this is a very good integration with endoscopic, for example. There's a streaming feed going to Hadassah, Jerusalem, where the head of the surgical service, Professor Eli Pekarsky, can detect the tactics right here and now. Also, we're developing pathomorphology, just like it can be done in an emergency way. It includes the cooperation of the operating block and the lab. So so during surgery, they can coordinate to see where the incision must be made. There's also doctor-to-doctor cooperation between Moscow and Jerusalem using these technologies in pathomorphology. So we're developing ray therapy. And in this case, we're talking about the planning for the patients, planning for ray therapy. Because we have line boosters here in Moscow, the same as in Jerusalem. And so we're getting a CT in a CT planner. Then this data is sent to Hadassah Jerusalem Clinic, where our colleagues, such as our supervisor, Professor Pokortser, who delineates the tumor, sends it back to us. And using this technology, we are executing the ray therapy. That's it. Thank you for your attention. That's just a short description of what we're doing. I can cover some of the questions and maybe discuss on certain things. This is what I'd like to do. And thank you very much for your attention. Thanks a lot. Colleagues, are there any questions on this one? I think it's usually very interesting to see how they do it, such a nice experience. But on the other hand, there's the opportunity of asking questions about the difficulties that they face. So we're talking a lot about telemed with colleagues from other countries, including the USA. I think they are one of the most advanced in this area. And of course, a lot of advantages, interesting experience, how it's going to develop, and we'll talk about that. It's not just about the doctor-to-patient coordination, doctor-to-doctor too. There are a lot of interesting areas of using this telemed with surgery, for example, but surely there are some difficulties that people may face. So here, I'd like to share some experience. Are there any difficulties and how are they solved? How do you motivate the doctors to use all this technology and avoid mistakes? I think the main matter here, the development of many novelty, are the legal aspects. And during today's discussion and session, I'd like to hear from other colleagues as well, because for us it's authentication and identification, how it goes, so that we understand that the patient lying there is definitely the one, so that there are no legal repercussions afterwards. Because things can happen, and the experience of other clinics and the colleagues will be just colossally useful for us. And I hope what we'll see and hear today is something new for us that will help develop telemedicine in Russia and the world.
Thank you very much. I don't see any questions so far. Once again, I'd like to remind you that we have a chat for your questions and comments. I've seen a question for Dinara. We will ask her to answer it in the chat. So let's maybe move on with the presentations. We will have to reorder a little bit. Maybe Alexander Alexandrovich, Director for Digital Transformation of METSI, member of the board, could begin now instead of the next presenter. You are on mute.
Александр, вас не слышно.
Alexander, you're still muted.
В интернете ходят, да, наиболее распространенные фразы из конференции в Zoom. Да,
The most frequently used phrases from Zoom. You are on mute.
Тогда, может быть, пока, Александр, вы решаете
Okay,
технические
while
вопросы,
you handle this technical issue, Alexander, maybe I can give the floor instead to Denis Alexeyev, the chief doctor of the regional hospital. Yes, hello, colleagues. Allow me to begin my presentation. I'll try to start showing the slides. I hope you'll be able to see them.
Надеюсь, всем видно и удобно будет посмотреть данную презентацию.
I hope you can see my slides. No, Denis, sorry, we're not seeing anything. We can only see the files, the documents. We don't see the slides. Okay, let me try again. How about now?
Денис Георгиевич, запустите, пожалуйста, демонстрацию экрана в целом, а не определенного окна. Тогда...
You need to start sharing your screen in general, not a specific window. Could you help me? How do I do this? I can start sharing a new screen, or I can continue transmitting. I've stopped your previous session. Click on the green button on your controls panel, and then select screen, your whole screen. Yes, we can see it now. Thank you. Thank you. I hope my presentation will be a testimony to what the president of our Samara University said, the use of telehealth for in-hospital and outpatient care, especially in remote areas and in smaller towns. As a result of implementing such priority national projects as health and healthcare, we have significantly improved the hardware capabilities of hospitals and clinics, especially for primary care. The data that we have obtained with the high-quality diagnostics equipment needs to be interpreted competently and communicated to the patient in a clear manner. During diagnostics and further treatment, some difficult, challenging cases may arise which require expert assessment with the involvement of a medical board sometimes. Unfortunately, on the payroll in smaller towns, in remote areas, it might be difficult to find such experts, such high-skilled specialists. As a result, patients need to be referred to medical centers in regional capitals or in some big cities, or some in-field visits could also be possible. However, this would be difficult because for the medical organization as well, because then they would have to send out a number of their patients, a number of their specialists on such visits. It is especially a challenge during the pandemic. Also, patients that are being provided care out of the hospital, once again amid the pandemic, the possibility of remote care is especially relevant. Especially when we're talking about vulnerable populations, elderly people, patients with chronic diseases. Remote monitoring is very useful with the adjustments in subsequent treatment. When there is an uptick in infection cases with the Omicron strain, for example, there is a risk of overloading the primary link in the healthcare provision chain. A possible solution to this could be using remote proactive technology for communication and interaction with wireless and wired technology. Telehealth encompasses a wide range of issues, but I, in my presentation, would like to especially talk about telehealth consultations based on the experience of the Oktyabrski District Hospital. Starting from the 1st of January 2001, we have fully migrated to the MEAC clinical information system with the module for telehealth consultations, which means communication in the doctor-doctor format and doctor-patient format is possible, including in real time, using multimedia devices for audio and video connection. Also, video broadcasting is available, for example, for primary care doctors, educational transmissions, and also an analytical block for automated record keeping and analysis of telehealth events and activities. But this analytical system has contributed to improving the quality of medical care and also improving the accessibility of medical care. The central municipal hospital, as you can see on the slide, is a third-level medical organization. So in the vast majority of cases, our specialists are initiating telehealth consultations. Usually it's a GP, a pediatrician on shift. They provide this statement from the medical records of a patient and a request for a telehealth consultation. The YENIA system generates this telehealth request based on the medical records and refers the patient to the relevant specialist, the relevant doctor, specifying also the preferred date and time for the consultation. Our hospital has been providing telehealth consultation in partnership with the Samara Medical University, the municipal hospital number 8, and a number of other hospitals and clinics when it comes to cardiology, traumatology, oncology, gastroenterology, and other medical conditions. The majority of consultations were for infection diseases. As the previous speaker mentioned, the COVID pandemic has forced us to make some adjustments in line with the temporary regulation on the work management of healthcare organizations. Remote communication of medical staff among themselves and with patients or their legal representatives can be done for collecting information about medical conditions, complaints, for remote communication with the patients, for generating electronic documents, and for referring patients for additional tests and examinations. In the doctor-to-doctor format, with different infections, COVID, flu, pneumonia, we have been working together with the Samara Medical State Medical University and its center, and we expect this partnership to be even stronger. A primary care doctor, the general practitioner, When they communicate with the patient, they may identify a reason to consult with a doctor of narrow specialization because there may be associated diseases, associated symptoms. So when the general practitioner finds themselves in the situation, they can contact the Samara University Center, which can help with the engagement of narrow specialization doctors. Last year, this helped to save lives and prevent severe diseases. The new strain and the associated wave, it underscores the relevance of this partnership with the medical center. And in anticipation of your questions, I wanted to share my conclusions about the hospital performance, our results, the hospital that is located in a small town, because I think that might be relevant.
На фоне коронавирусной инфекции, когда дорог каждый сотрудник и каждый
With the COVID infection, when every minute counts, the effectiveness of telehealth consultation, it depends on the completeness of information provided to the doctor. So providing medical record statements that can take time, especially if it's done manually, unfortunately, still there is a lot of manual component in record keeping, in generating such discharge statements. This is additional load on the medical staff, those who generate the documents and those who have to interpret them as well. So I urge my colleagues to enter information about patients as soon as possible, as you get it, so that the document can be later on generated automatically very quickly. Together with the multifunctional centers and other institutions in the healthcare system, it's not just about the document in the information system, but also links, references to telemedical consultations. We've had discussions about identification of patients. The thing is that at the moment, when generating a request for a telehealth consultation, the reference, the link to the telehealth consultation is sent on this Goslugi public services portal.
Достоверность и верификация пациента.
That is about patient verification. And as for the near future, telehealth will keep penetrating our lives, everyday life and professional sphere. This is one of the rapidly growing areas of healthcare. Roughly 20% per year is the growth and investment in this industry. And we already have a lot of good groundwork for diagnostics and monitoring and consultation.
Ну и, на мой взгляд, система телемедицинских консультаций в
In my opinion, telehealth consultations very soon will become an integral part, both for medical staff and for our patients. For prevention, for example. Thank you for your attention. I'm happy to take your questions.
Да, Денис Георгиевич, спасибо большое. Очень интересное выступление. Есть
Thank you, Denise. Two questions in the chat. The first one, what is the percentage of doctor-patient consultations happen in your NES system? We have roughly 10 to 15 telehealth consultations per week. that is doctor to doctor, doctor to patient, in real time, doctor-patient consultations, that is 2 consultations a month maximum. I think we need to engage people, especially in smaller towns, in using the public services portal, so they can benefit from the functionality there, telehealth functionality. In smaller cities, it is a bit of a challenge because the engagement is very low and we need to increase it. The higher the engagement, the bigger the amount of telehealth consultations. And another question, what problems have you been facing with organizing this telehealth consultation format of work, and how difficult has it been for the medical staff? As for the organization issues, I'm sure many will experience them as we transition to telehealth. Of course, primarily it's the time that doctors have to spend on preparing documents, on paperwork, on preparation for a consultation with a patient. Some help may come from electronic document flow, because doctors need a complete set of documents, complete set of information. As for doctor-patient, there's probably just one big problem, but it's easy to solve it. The contact details of the patient. When we send a link for a telehealth consultation, we always copy that link and send it as well in a text message. Not everyone uses the public services portal. Not everyone checks their emails regularly. So we also do this via text. Or we can call our patients in advance to remind them about the consultation, because otherwise that would be a time slot that is left empty for the doctor. Also, with telehealth consultation, same as for other work, we need to actively engage narrow specialization experts. As work will also need to be monitored and assessed quantitatively and qualitatively.
Проведение телемедицинских консультаций будет выделено, ну, если не, скажем так, отделение или кабинет, то, по крайней мере, отдельный специалист, который будет курировать это направление, готовить документы и брать на себя организационный аспект проведения этих консультаций.
Денис Георгиевич, спасибо. Там еще пару вопросов есть в чате.
Denise, a couple of more questions in the chat. Perhaps you could answer them in the chat, and we will move on because we're a little behind the time. I'd like to ask Alexander Pilipchuk to take the floor and start the presentation. Hello, can you hear me now? Yes. Okay, we'll start sharing the screen. Thank you very much for organizing this roundtable. I think it's very important in today's context to promote telehealth, not just among patients, but in the professional community as well. My presentation will be about our experience with telehealth, a couple of words about our company, medx. medx is operating in the market of commercial healthcare, of healthcare in general, for 25 years, more than 50 clinics across the country. We are, of course, mainly leading in Moscow and Moscow area, but we have also been expanding our presence in the region. And along with opening new clinics and hospitals, we have also been developing digital services, of course. One of the key services for us is telehealth. We have our platform, digital platform called SmartMed, which is supposed to be this digital glue, which makes it easier for our medical organization to provide services to our patients, whether it is a region of our presence or not. We have been developing our telehealth services based on a set of metrics, and we also have a pretty big pipeline, a funnel for new ideas for implementation. The platform has been operating since 2018, and as of September 2021, we had more than 1 million downloads. And overall, this is the basis, the foundation, the strategic project based on which we have been developing our digital health.
Now going specifically to telemedicine, the purpose of this report, tell you about how it works with us. So telemed can be executed about, talking about the patient-to-doctor segment. So we have three ways, just like the colleagues that presented this, three ways to make this cooperation. First is the chat, where the patient can write to the doctor, load some tests, which he made in any system. There's audio and video link. Talking about the services, we have emergency consultations that work in 24/7 mode, and where therapeutic specialists are working. This is the line for alleviating tensions and concern. And so they answer very fast in order to solve the patient as fast as possible. And there are planned consultations where there are specialists, neuro specialists who work in the medc clinics as part of their schedule. So the patient can come in and make an appointment for a telemed service. So he can choose either it's a personal one or a telemed one. Talk about the results of 2021 and the dynamics. Of course, COVID made a positive correction on the development of telemedicine, so the service has become more popular. As of now, if we look at the current area, more than 75,000 consultations since the start of SmartMed, and 1.8 consultations per patient in telemedicine. Potential is very big, and there's still room for improvement. What I want to pay attention to is the structure. If you look at the share of planned consultations and emergency consultations, 50% are the emergency ones, and 20%. And 80% is turning to a neuro specialist. Usually, these are the patients that already visited the doctor personally, and they want to correct the treatment or tell them something new about the dynamics. Using the aggregators market practice, the projects that specialize on the telemed help, they will see another structure, vice versa. So there, at 15 to 20% of the patients turn to neuro specialists, and 80% want emergency health. So the structure is a little bit different. That depends on the audience with which the project works and which is aimed at working on. Our presence, we are developing and involving specialists in telemedicine. As of now, if we talk about narrow specialists, there are 25 areas. There was a question, are there any difficulties in the involvement of the doctors? Yes, there are problems. This is actually requires separate testing. Not all doctors are present, but we have certain goals for this, for the growth of the presence of doctors. And so in a planned manner, we're developing this area. But before the doctor is represented in telemed, he or she undergoes special testing. First, legal aspect, important limitations that they need to comply with. Second, technical aspect, working in the system, what kind of buttons to press, etc. And third, last but not least, is ethics, or the standards of appointment. We see that the telemed appointment is different from the personal one, and usually with emotional aspects. So usually, sometimes you don't have to say certain things, and the doctor can understand something. There's a specific link between the doctor and the patient. While in telemed, using the screen, it's a bit harder, so the doctor must pay more attention to the structure of the consultations, in which the questions that they're asking, in which order, the explanations that they're doing, what they can recommend, what they cannot recommend. This is an important aspect. I think all the medical organizations that start to work in telemed can face that and working with that. Here also you can see the most popular causes for appointments. Of course, there are some legal limitations that don't allow us to use telemed as widely as we would want to. Usually people turn to us with a cold or virus symptoms, especially now. Then inflammation on the skin. Next comes pains in the stomach, diarrhea. Then comes, let's say, the enlightening consultations. There are questions on gynecology, on vaccination, on what to eat. They just want to know what is normal and what's not. And last one is the reproductive system. I already mentioned the limitations. Of course, there are technical aspects that the colleagues already mentioned that identification of the patient. So we want to expand this identification, like using the same ID method as the banks use. Also, what constrains the development is the lack of possibility to make making a diagnosis, but it only can be done after a personal appointment with a doctor. Today, under the aegis of the development, the Ministry of Health, we're starting a pilot project in 3 companies: medc, Dr. Rядом, and Sber Health. We're launching an experiment in which the legislation will have some easing on the aspects that are currently banned. I must say that we as the medical organizations understand that there are risks. We realize that, and we, of course, the doctor must make a diagnosis. So based on the information given by the patient, if it's enough, they can make a diagnosis. If not, they direct the patient to an additional research. It's not clear whether the pilot will start or not. Yesterday was a hearing in the Federation Council. Discussion is going on. I hope this initiative is launched, and then we'll be happy to share the results, the effect. But currently, I can only say that we are trying to advance it as much as we can. How we see the value, the use of telemed on our business model? Surely, it's commercial. It must have a clear business effect. I would subdivide into 3 blocks. First is effect for the patient, effect for the medical organization, and third is for the effect for partners, such as insurance companies, who are our main partners. Talk about cooperation with the customer base. What the numbers tell us is that there's the understanding of LTV. That's not the average check. It's a sort of a, let's say, an amount of revenue that can be seen in a certain period, now for a year, that we generate together with the patient, which characterizes just how the patient is loyal, whether they're coming back to us. Talking about the use of that, the app. Patients who are active with the app are 13% more loyal considering LTV than those without the app. We must say that the penetration is rather high. About more than 50% of the patients turn to us, do that through the app. Also, the patients who had just at least one telemed, emergency or not, the LTV rises 1.5 times, 62% higher than those that had never used a telemed. It's the chicken and egg question, but anyway, fact is that telemedicine doesn't replace personal appointments. It's not a threat that everyone will go online and will not come to the clinic. It's actually quite the opposite. They will be more loyal and turn more often to the clinic and will be able to ensure better treatment. For our partners, the insurance companies, of course, there are some cases where a telemed can reduce their costs. For example, without statistics, more than half of the patients who, before the personal appointment, when they turn to telemed, then more than half don't come to a personal appointment. That means the problem is not very serious. If not for telemedicine, the patient would have to get to an appointment, generating costs of the insurance company. And 14% of the patients turned for another telemed consultation. So they saw some use in that, and they just wanted to solve it, finalize it with telemed. I must say that these are just the value for the insurance company can measure in numbers, but the scale of that is actually more. It can be expanded. It is constrained, I will repeat, by the legal constraints. The third block is value for the clinic, why we need it. So just aside of the things that I just said about the patients, talking about the schedules, telemedicine is a good tool to fill in the gaps. There's not popular slots, unpopular days where the doctors are working, but the schedule is not fully filled. So telemedicine allows to provide this slot for remote patients. Quality control. This is a very important aspect. Of course, we're not just doing this just for the sake of it, consulting everyone just online. We are, first and foremost, the medical organization who understand the meaning of quality. So we're making constant internal expertise of the appointments, of the calls, and through the SmartMed service, we, after every consultation, we're gathering feedback from the patients to see if there are anything to do. Usually, the most widespread complaint is the inability to get a diagnosis. So people turn to a doctor, the telemed, expecting to get a diagnosis and to get treatment. This we cannot yet do, and this is something that people are not very glad about. That's the end of my report. Thank you, dear colleagues, and I wish you all a nice day. Thank you, Alexander. There's one question in the chat. Is it implemented with the state insurance? No, it's just with private and additional medical insurance channel. Thank you very much, Alexander. Next, I'd like to pass the floor to Dmitry Konstantinov, Director of the Medical Institute of Samara University. Hello, dear colleagues. Right now, I'm loading my presentation. You can see it. Yes, we can see it. I won't take too much of your time and speak about the things mentioned by the colleagues, about the difficulties the pros and cons of telemedicine. I just wanted to share my first experience of using personal digital assistant for the new coronavirus disease. And I need not explain, because everyone accentuated that this is pandemic. This brought us into a very special state, and we need to get out of these difficult moments. The appearance of new variants, hospitalizations, lethal cases, the loads, this had to lead to looking for something that can ease the state of the patient and the doctors, because patient is number one. Health is a service, and the quality of service, medical service, is the main thing. In the Samara State Medical University, the Institute of Digital Development, Innovations Development, created the innovative digital ecosystem called Hub, considering remote biomonitoring for remote medical health for patients with COVID. So the ready product is called the anti-COVID case, which our rector spoke about. The slides are not changing, you know. Can you get to the presentation mode and switch to the slide which you're talking about?
Видим?
Нет, может быть, вы отключите еще раз, попробуйте.
Давайте выйдем.
Дмитрий Юрьевич, вы можете попробовать в верхнем настройке тулбара на оранжевом фоне кликнуть на вид.
Я вот уже вышел.
Режим чтения.
Вышел. Вот так видно?
Видно опять вот первый ваш слайд, и он не в презентационном режиме, да.
Кликните на вид сверху в настройках и затем на режим чтения. Обычно всегда помогает.
На вид. Режим чтения. Так вот видно?
Пока не поменялось.
Не меняется?
Да, давайте, может быть, я перехвачу, а вы мне просто скажите, на какой слайд прыгнуть.
Давайте вот с третьего.
Да,
Do this for you. I will share your presentation.
Тут немножечко.
Так, сейчас, секундочку. Следующий, да?
Да, следующий вот. Да, вот как раз мы говорим по цифровому систему.
Right, next one. So we're talking about the Hub digital system. It was developed by our specialists, by the IT team and our medical staff. This is specifically for helping people with the new COVID infection. So this is our product, the anti-COVID case. It's the suitcase, which has a set of devices. Next slide. Right. So this is the set of devices given to patients, equipment for measuring the oxygen in their blood, the fitness bracelet, device for measuring your pulse, etc. Next slide. This is how it works. All the devices handed over to the patients. They are mobile. They can be used for remote collection of data. Then the data can be transmitted from a mobile device using Bluetooth to a laptop or computer, and then sent to the doctor using the health checkup digital ecosystem, also developed by our specialists. All the parameters, next slide, all the parameters are shown in these dashboards. It can be also seen in the mobile application. So the patient can view the results and the doctor has access to them too. Data are collected and transmitted to our unified network. Doctor connected to the internet can log into this application on a laptop, a PC, a mobile device to monitor the results. Next slide, we can monitor all the parameters above or below the reference rate. And we have also developed an algorithm for remote supervision, remote monitoring for patients with COVID-19. The anti-COVID suitcase is delivered at home. If necessary, the specialist can take the initial blood test, and then daily, at least once, or if necessary, several times a day, the amount of glucose is measured up to 4 times a day, if necessary. Biometrics once a day or more frequently if necessary. The fitness bracelet. Then the doctor remotely monitors the patient parameters over time, at least twice a day. If there are some concerns or the system highlights certain parameters as concerning with yellow or red, if they are way outside the reference range, then the doctor can quickly contact the patient remotely by video conferencing. The scheduled video conferencing meetings are once a day. Once again, if necessary, the frequency can be increased. And overall, the overall monitoring term is 10 to 20 days. The remote biomonitoring with COVID-19 patients, we have had several tests of this system, and we are currently engaging patients with this system. We have 6 patients with suspected COVID-19 and 4 patients with confirmed COVID-19. We've been testing the efficiency, the convenience. Is it easy for us to collect this complete set of information in this format? The average age is 52. Most of them men. 60% of these patients are men. This is one of the patients. Next slide. Basically, even for elderly patients, this is quite user-friendly. The tablet can be set up very quickly, and then all you need to do is to make sure the battery does not die, and make sure the information is continuously collected and transmitted to the doctor. So as I said, the green ones are normal, red parameters, red highlights above the norm. Different parameters, physical activity, glucose, oxygen saturation, temperature, pulse, etc. One of the patients has been admitted to our hospital on infection diseases, operating as a COVID hospital since May 2020. More than 4,000 patients there already since then. Of course, this is a big load on the system. So this patient, 58 years old, had been monitored remotely at home. Then he was admitted to the hospital. By day 7, there was this abrupt fever, and the saturation started to go down very quickly. By video conferencing, we also noticed problems with breathing, heavy breathing. One of the things that we are testing at the moment is a phonendoscope. We're going to include it as well in our kit. So this patient was recommended for hospitalization. CT detected level 2 of contagion. Right now, the patient is stable, is feeling fine. We understand that there is still a very big load on the healthcare system, and with COVID-19, it's important to act fast. So in this case, everything was organized very efficiently. As for the doctors and what they think about it, of course, it can be a bit challenging, but the staff at the clinic, they are pretty young, most of them, so they know their way around a computer, so to speak. Of course, this does require some time, some digital skills, and the willingness to work remotely, because this is still a non-traditional format. But for us, the main thing is that we understand the pros and cons, and we take advantage of it. This will allow us to reduce the load on the system and possibly the mortality rate. This will also help us make adjustments to subsequent therapy, because we can instantly see parameters that are above or below the norm. And there is great room for improving the system, adding more parameters, more information. And we can minimize the number of visits to clinics and hospitals without reducing the quality of medical care. Of course, improving the work of this ecosystem based on feedback is something that we are doing at the moment. We have been collecting this feedback. First, we tested it with some of our resident physicians, then some of our colleagues that got infected and had to stay home, and now with patients. And ultimately, we want to be able to create a smart digital avatar, digital twin of a patient. This biomonitoring system, we hope, will enable us to extrapolate all these processes onto some other conditions, maybe even chronic conditions, to improve medical care overall. So this is our experience. I'll be happy to take your questions. Right, colleagues, please send your questions to the chat. I think it's a good practice we've established with questions in the chat and answers in the chat as well. There's 4 more speakers. We need to wrap up at 12, so I urge our next presenters, since we have already talked about a lot, maybe you could focus on the things that haven't been touched upon yet. I would like to give the floor to Maxim Kuzminov, Medical Director. Dr. Sam.
Спасибо большое, коллеги, добрый день. Сейчас сделаю, включу демонстрацию экрана. Ну, как бы тема достаточно уже...
I'll start sharing my screen. A lot has been said about it, so I will briefly describe our vision of it. Our company, Diagnostic has a lot of medical experience, and we have the possibility to expand our geographical presence across the country. And together with Rostelecom, we have been working on regional systems, ICT systems. So I will try to explain what we mean by a personal medical assistant and what are these capabilities for the healthcare system. Of course, it's absolutely essential to adhere to laws and regulations, and we have experience of that too. So to ensure compliance, a very important thing is the integration with all state systems that there are, that medical staff use. So our competitive edge, our advantage is that we have integrated. Excuse me, Maxim. If you are switching between slides, we are not seeing it. No, I'm still on slide 1. So we've been integrated in 34 regions, which means that within a week, we can connect people to our platform and provide services. What is a personal medical assistant? We have talked about telehealth and remote monitoring. For us, a personal medical assistant is this symbiosis of telehealth, remote monitoring. An important thing is that telehealth is essentially used in the government healthcare system only for monitoring people with chronic diseases. And it's important to get to a situation where, based on the remotely collected data, we could perform active measures in monitoring the patient. There is a treating doctor that refers to remote consultations, remote monitoring. There's a Telehealth Center, a dedicated structure. I will explain later why it is important. That does the monitoring. So the center receives data from the monitoring. After the treating doctor reference, the data are analyzed automatically, and there is also oversight when it comes to data analysis, because it's one thing when you just provide the tools, the equipment to patients, and that's it, you're out of the picture. No, there is oversight needed.
Пациенты не стимулированы заниматься в большинстве случаев, решать свои проблемы, поэтому если мы хотим привести эффективность, пациентов мотивировать, соответственно, должна быть
motivate them. So there needs to be a service that does the oversight, that talks with these centers and patients and teaches them to use the devices correctly. We have all that. We can provide this to the regions, so we can provide the training as well. An important moment is where information is received that a certain parameter is above or below the normal rate. Important to be able to verify whether there has been a mistake in the measurement or not, because sometimes information can be false because of improper use of the equipment by the patients. So first, the oversight, the training, and also responding quickly. The treating doctor that prescribes this remote monitoring, that doctor must respond quickly. Of course, the doctor himself or herself may be struggling to do it, so they will need to delegate this function. And this is where technology can come in and help. I will show you the examples to illustrate how we do it. Information is filtered, validated, and the doctor receives the information on the patient they require their attention. Also, the issue of responsibility. In addition to technology in this area, part of the responsibility is on us. And so when we transmit this information from the patient to the doctor needs to be able to verify, we need to be able to verify that the doctor has received this information. And if that hasn't happened for one reason or another, we can contact the doctor or the administration of that institution to urge the doctor to respond quicker. There are other telehealth capabilities. The treating doctor can use our platform to contact the patient if some adjustments need to be made to the therapy. That can be done. The parameters, the information is collected. We try to collect it in various ways. So initially there is a push notification or a text message to the patient with a request to provide the information. If that does not happen, if the patient does not use the medical devices and does not enter this information in the mobile app, then the personal medical assistant can intervene and call the patient and ask about their condition and ask them to use the device. And if that does not help, the call center gets engaged and they can ask family members of the patient to help them collect this information and transmit it. And if the patient cannot be reached, we also need a special system, a roadmap of what you can do, maybe call an ambulance or contact family members once again, because that is high risk, high responsibility, and it needs to be done very thoroughly.
What I'd like to ask you is to speed up a little bit. Okay. So in addition to personal profile, there's also the profile for the call center, and there's an administration that controls the quality, can set up templates for every disease. It's the interface I won't show it because time is running out. So use the monitoring COVID patients, what is reported today. Recommendations of the ministry for monitoring COVID. Actually, we started doing almost the same thing in summer 2021, and there were pilots in the Leningrad region and Tyumen region. Have the statistics. 4,465 patients. For them, we had 80,000 collections of the indicators, 767 consultations of the emergency doctors, less than 1%, and the result is as follows. 177 finished with this online consultations, 24 are calls of the ambulance, there were cases of blockage of the arteries, which patients didn't see as life-threatening, but they were. They were hospitalized, so all this was confirmed, so it was done on time, and lives were saved. And based on the report, there was very good feedback. Decrease by 80–90% the amount of work time spent to monitor COVID patients. Less questions about the dynamic monitoring. Then there were additional comfortable things added to the employees of the registry office. Alexander, thank you. Maxim, thank you very much. There's a question to you, please cover it. It's answered, but use the chat to answer. I'd like to pass the floor to Dmitry Dmitlakov, Director of the Cardiological Institute of Samara, Cardiological Center. Floor is yours, but we cannot hear you. Yeah, we can see my presentation now. We can hear you rather nice. Yes, I'll try to make it short. So last year we decided to make a randomized pilot research on monitoring chronic cardiac diseases. It's actually very actively carried out in the world. In Germany, for example, results are different depending on whether the first segment of the healthcare is prepared, whether telemedicine are deep enough, how they are made, and the results are always different. So you must also be careful about the design of the research. Our aim was to decrease the lethality and secondary hospitalizations of the patients. This can be done. These were patients at the hospital stage, getting out of the hospital with a special therapy. We very well understand that one of the factors can be decrease of the blood pressure with certain drugs, certain medicine. And we finalized this research on the 30th of December last year. We had the last patient, and we received data on that. And in January, we just started the processing of the database that we have. So we calculated the most important indicators which are the cornerstones in medical consultations. The slides are not changing. What about now? You need first to put it into presentation mode. No, you must just switch to presentation mode.
У меня вашей презентации нету, поэтому здесь я не смогу.
Don't have your presentation, so you don't see it. No, we can see it. Now you can see. You switched. All right. You're on slide 3. Yes, you can continue. Oh, turned on the reading mode. Is it not full screen? And I think you will be able to switch the slides.
Ну, тогда мы здесь будем двигаться. Почему-то не совсем понимаю.
Я предлагаю, давайте будем двигаться.
Да, хорошо. Итак, мы включали пациентов с сердечной недостаточностью. Я уже говорил, это пациенты...
What I said is with the patient, either with the infarction or initial hospitalization, cardiac arrest, and so these are patients whose life expectancy or the need for further hospitalization could have to do with events not related to this cardiac system problems. So we screened for 100 patients who were subdivided into 2 groups, monitoring and blood pressure, just 4 visits every month. So a priori we identified that the length would be 3 months. Didn't calculate the strength of that because we will realize that it's very hard. It's a pilot project, hard to generate further hypotheses. But the group, as you can see, for the incoming diagnosis are comparable. If we talk about the sex and age, body mass index, arterial pressure, no difference among those. So what we looked at was the dynamics of arterial pressure, blood pressure, in the group that was controlled. We expected that it would be better. The pulse, because the medication was the same, it was one of the criteria that groups to be comparable. So the groups with a chronic cardiac disease, we received improvement of the ability to walk for a longer time and tolerance towards physical stress. And about hospitalization, 4 hospitalizations in the monitoring group in 3 months, 30 days. Reasons for hospitalization, and 13 hospitalizations for other diseases, 133 days. 133 is the number of hospitalizations, and the difference between groups is very big. Actually, we didn't take the cases for ambulance because now ambulance is not working how it should. 2 parameters: the mortality, cardiovascular causes, 6 lethal cases, heart cases, 2 times less. Here in the monitoring group of arterial pressure, 3 patients died of COVID-19, and in the standard group, 1 patient. So if we take a look at the mortality from cardiovascular diseases, we get 0.052, the reliability number for that. So we can well understand this, such an approach. So the approach with the patient, with telemedicine consultations, with monitoring blood pressure, these are the patients. So what I mean is, they had a special tonometer which gave us data live on blood pressure in hospital and at home. We saw it in the cloud. We could call the patient, correct some the medicine that they were taking, and further analysis will be carried out. I initially said that this was just preliminary data. On the 30th of December, we ended the collection of data. There will be a deeper statistical analysis. What factors contributed to that, to the death toll of cardiovascular diseases? So this will continue and expand. So we can say that this distance consultations monitoring for just as little as 3 months demonstrates a decrease of the number of hospitalizations and in trend in decreasing the general death toll from cardiovascular diseases. That's a very good result. We'll continue to work on that. Thank you. Thanks, Dmitry. It's a very good example. In the chat, there's the link, a very short survey about today's meeting. It is very important for us. While we have 2 reports, pass the floor to Ekaterina Kuzina, Med Director of the Digital Medical Service, Dr. Rядом. Hello, dear colleagues. Can you see the screen? Wonderful. Try to make it short. I can see that there's not much time.
Один момент, прошу прощения.
One moment, sorry. Maybe now I'll pass the floor to Ben Horner from Great Britain, who can... No, it seems like it's working. We can see your screen right now. Pass the floor to Ben, because he has to leave as well very soon. Member of the Surgical Association of England. So I would like to ask you, Ben, to focus on this topic. Today we spoke a lot about doctor-to-patient segment, but you can see that it's expanding. So Ben, can you please comment on the segments that we also see that can develop and will continue to develop?
Ben, over to you.
Great. Pleased to meet you all. I'm a former academic surgeon from UK, also worked in the US, who now has a pleasure to follow both my passions of developing healthcare and interest in digital data and analytics. I'll just speak for 1 minute around the trends we see looking forward. I think there's been a lot to talk about what's happening now, and it's very exciting. There's a lot happening, but I think we are, as we know, healthcare lags behind many other industries. And as we look over the next 5 or 10 years, I think this is going to completely transform. There's been a lot of focus around chatbots, and then remote consultations, particularly through COVID. And we've seen many companies launched and grow in different parts of the world as we look. But as you look forward, and the big focus to now, and we've heard some things about that today around remote monitoring and how that can be incorporated into it. And then as you look forward, beyond that into what can come next, there's a whole range of opportunities to actually combine this into an integrated offering with digital therapies as well to treat. Now, I think if we look forward over the next few years, I think this, we'll go to the next slide, Katya. There's, I think, 3 or 4 trends that we see. First is this vertical integration of the digital platforms. At the moment, it's quite fragmented. There's a lot of different products that are point solutions. But if you can get the interface linked to the device, linked to the analytics on a single platform, giving an end-to-end offering, then I think that offers real opportunity, particularly as we think about healthcare, where up to 50% of spend is on 5% of the population. There is a real pain point there that we're not addressing, which actually requires this much more end-to-end approach. And this is the big enabler for unlocking that. Secondly, is this, as we do that, to get there, I think it will be expansion into different specialties. We started on the relatively simple end-to-end views. So we can, urology, orthopedics, these episodic procedures, that there are already end-to-end platforms. When you start to think around long-term conditions such as chronic obstructive pulmonary disease, and these the ones that really are driving the cost, they're not yet linked together, and I think there's a real opportunity for that. I think the chat to do that though is going to require collaboration. At the moment, it's different companies providing point solutions in different places. They're not necessary. There aren't single companies yet providing all of these elements. So it will take collaboration, some consolidation in the market, or some. I think that we're in supporting more than one player that's thinking about platform plays that could actually be the person that connects these things together with the analytics to unlock the synergies. I think the final piece of that is about unlock the full potential, is about the regulatory flexibility. And we know, I think that falls into 2 parts. There's a piece around, is it worth it in terms of the money? And I think that COVID has really helped unlock some of the simple use cases at scale to demonstrate it can really save money. And the other is it safe? And I think that's where some of the, particularly the medical community, and speaking as a doctor, where people are most nervous as you start to think about that. But again, I think we are starting to see this is, as this commoditizes, we're starting to get the proof points on that too.
Бен, спасибо большое. Если есть какие-то вопросы к Бену, то вы можете кинуть в чат, и потом мы поделимся ответами. И тогда
looking forward to your questions in the chat.
Александровна, еще раз передаю.
Ekaterina, once again, back to you. Yes, hi again. Of course, I won't speak about the relevance of telehealth. It's obvious. I will just briefly talk about the global experience. The US, for example, a pretty complex system. There is no public system similar to ours, but there are federal programs supported by the state, and the federal laws do not view telehealth as a separate service, so any laws and regulations on medical care, on healthcare services also cover telehealth. Remote diagnosis, electronic prescriptions is possible, and also assigning treatment. France, the 2009-2010 laws on telemedicine that delineated the core areas of telehealth They were the framework for the telehealth service at large. And since 2018, telehealth services have been available in the system of the local mandatory medical insurance. The doctor there is responsible for the format that's best for the patient, whether in person or remote. The UK, a pretty intricate system of regulation in healthcare to control the quality and safety of medical care. There are in-person and remote services, consultations, and telehealth has been increasingly more integrated in the overall healthcare system in the UK. China, of course, since the outbreak of the pandemic, telehealth has been growing exponentially. Across China, the National Healthcare Commission encouraged the use of remote medical services to minimize the transportation of people and to decrease the risk of infection. Penang Good Doctor, the biggest healthcare platform in China, 900% growth in the number of users by January 2020, and an 800% increase in the number of telehealth consultations. In Russia, one of the biggest problems is the shortage of medical staff. On the slide, you can see the distribution across the regions, which regions are experiencing the shortage of talent in which areas, in which specializations. In 2020, the Russian Statistics Agency published the data for 2018. Unfortunately, the pandemic has aggravated this problem, and I think telehealth could be the solution to it. It could help patients and doctors gain access to consultations with doctors, with a colleague, with experts of narrow specialization who are lacking very much in the region. And I think this way telehealth can really be a big supporting sector for the healthcare system. WHO said that telehealth is a key tool in fighting against the pandemic. All telehealth services have experienced a growth in the number of consultations. During the first lockdown, our company conducted more than 100,000 free consultations supported by WebRS. They were completely free of charge for everyone living in Russia. Dr. Rядом, our company, has conducted overall more than 300,000 consultations on our platforms. In 2018, we have more than 700 doctors, more than 40 areas. We are also included in the system of mandatory health insurance in 6 Russian regions. We are sometimes designated as a separate service or sometimes included in the health insurance program. The expert assessment, Dr. Rядом, Dr. by your side, we hope this will help develop telehealth in our country. According to our data, we have been a tremendous help for our patients, and we can say that we are effectively routing patients from general practitioners to specialization doctors. We provide timely recommendations ambulance recommendations. We also support our customers after consultation. We verify diagnosis. All the diagnoses that result from a telehealth consultation need to be verified during an in-person visit. And we also use lab research, instrumental research, to help doctors diagnose more accurately. This is one of the big issues in the current legislation, is that the experimental legal framework that we're trying to push, that we're trying to get approved, it will allow doctors to use the full spectrum of research, diagnose patients accurately using telehealth. The company has relevant experience in addition to the consultations. We have our own tech platform compliant with those security standards. We are also integrated with medx to verify all the data in our system. We also have experience in engaging external medical facilities and institutions to our platform. In such situations as the pandemic, we can scale up very fast and we can provide services to more customers instantly. I think this is it. And also one more thing, telehealth services at the moment focus on verifying medical records, medical documentation, quality assessment. We check 100% of our protocols, the consultation documents, looking at not just what the doctor indicated, but also the consultation protocol, what was the communication between the doctor and the patient, and we always collect feedback from our customers and respond to them quickly to make sure the satisfaction with the medical help only increases. Thank you.
На самом деле, конечно, очень здорово видеть, что
Thank you very much. It's great to see that in the world and in Russia, there are a lot of examples, a lot of solutions in Russia as well to develop these services. Great. I will ask Alexander to summarize one quick comment before I give him the floor. I wanted to once again remind you that there is a link in the chat to our survey, and when the Zoom meeting ends, you will no longer have access to that link, but you can go to the medx.pro portal in the section for transmission. This is where you'll be able to find the link if you haven't saved it yet. So just so you know, it's there on the website. Really curious about what you say in the survey. Okay, Alexandra, the floor is yours for the final remarks. Unfortunately, Alexander had to leave for an urgent meeting with the administration. Right. Maybe you could wrap up the roundtable instead. Well, I think I said the key things that I wanted. That was a very interesting and inspiring session for me, and even more so because we had specific facts and figures and results. Of course, there are issues related to regulatory framework, initial diagnosis via telehealth consultations, that is still an issue. But I'm sure through such meaningful exchanges and discussions, we'll be able to find solutions to some of these problems, because there are, as I said, a lot of examples that show that the results, the effectiveness can outweigh the risk. I'd like to thank all the speakers. Thank you for your time. Thank you for your presentation. And thank you for your questions. I hope to see you soon. Have a great day.